The second wave of the pandemic has been devastating India since April 2021. Tamil Nadu and our working area in the bioregion of Auroville are not an exception. Auroville Village Action Group, a unit under the Auroville Village Action Trust, is an organization for integrated development. Located in the Vanur block of Viluppuram district, it is engaged in participatory rural development for more than 30 years in 75 settlements in the bioregion of Auroville, covering around 1 lakh people. During the first wave of the pandemic, we undertook a collaborative initiative with the support of the Auroville Internationals, funding organizations, Aurovillians, friends, donors, and units and schools in Auroville to help the communities to cope with the impact of the pandemic. Even when the country was in total lockdown, we worked with the permission of the government to initiate relief, prevention, and awareness in the villages. Our pandemic response was not aimed at charity, but fostering unity and harmony within the communities by bringing together different caste groups, men, women, youth leaders, and the government representatives to control the pandemic. The second wave is more severe than the first one, and it has placed a major strain on the healthcare and economic system of India. The pandemic has widened deeply the gap between the rich and poor, with more and more people losing their livelihood. We see fear and loss of hope in the eyes of the people. This time again, we are initiating a participatory campaign in collaboration with the village and street level task forces that were established last year and the government. Based on the needs expressed by the communities, this campaign is aimed at prevention and education of the communities in the bioregion of Auroville and support the families of the infected and most vulnerable people, like those who are physically challenged, the single women, the many old and isolated people, as well as those who have lost their livelihood due to the second wave. We nurture continuous linkages with the government and we educate the communities on safety and hygiene practices, raise awareness on the vaccines and homeopathic and Siddha medicines recommended by the Government of India, and would also like to give food essentials to the people impacted severely by the pandemic. Along with that, we are also providing masks made by the women at the Social Enterprise AVAG, supported by our organization, and the women who have lost their livelihood due to the second wave. To keep this successful campaign going, we need your support. Any support, donations, in kind or financial, is deeply appreciated.